Hello, my name is Dr. Michael Hall. I'm a specialist in non-surgical spinal decompression. Our topic today is degenerative disc disease. Any medical dictionary will tell you that a disease is a health condition with a recognizable set of signs and symptoms. There are 3 signs that a disc is degenerating, and I'll tell you what they are in just a moment. A disc, of course, is a circular flat object. A frisbee is a disc. An automobile tire is also a disc. Degeneration or degenerating means that over time the condition gets worse. Further, the worse it gets, the faster it gets worse. In other words, as it goes downhill, it picks up speed and it goes further downhill that much faster. So what are the 3 signs that a disc is degenerating? Number 1, the disc is getting drier. Number 2, the disc is beginning to bulge. And number 3, the associated joints, the vertebrae on either side of the disc, are becoming arthritic. So that was simple enough, wasn't it? However, to fully appreciate degenerative disc disease and how important it is that this get handled, you have to understand a little bit of the anatomy of the spine. And we're going to go through that in just a moment. The problem with degenerative disc disease is that the spinal cord and the exiting spinal nerve roots are a very close proximity to this intervertebral disc that we're talking about. And by close proximity, I mean they're exactly right next to one another. Now, a couple of things. I have in my hand a intervertebral disc with 2 vertebrae on either side. This disc is fat and happy. If we tip it so that you can look down at it from the top, the round part that the disc sits on is called the body of the vertebrae. And immediately behind the body of the vertebrae, there is a canal or a channel through which the spinal cord goes down. So of course it goes from your brain all the way down the back side of these vertebrae through that canal or channel. And I'm going to stick a pencil up through that canal so that you actually can get the idea that that is exactly where the spinal cord goes. Now in this hand I have the model of the spinal cord that I pulled from the vertebral model. The big thick thing right here, that's the actual spinal cord, and it goes all the way up and all the way down to your tailbone. The branches on either side are called the nerve roots. These nerve roots exit between the vertebrae. Let me show you that. Right here is the hole where the nerve roots exit. And I'm going to tip the vertebrae forward so that you can see this very clearly. The top vertebrae, just the way it's made right here, creates a notch that points downward. The bottom vertebrae creates a notch that points upward. When you snap 2 vertebrae together with a disc in between, it creates a hole once again right in here through which the nerve roots exit. Now, the problem, number 1, the first sign that a disc is degenerating is that it gets drier. And eventually, as it gets drier, it begins to physically lose height. Now, as it does that, as the vertebrae get closer together and it loses height, it stands to reason that the nerve hole is going to get smaller. That in itself can apply pressure to the nerves, and in extreme instances actually pinch the nerve. The second problem with allowing the disc to get drier and drier is it loses its ability to absorb shock. A disc is a rubbery, cushiony kind of shock absorber, and as it dries out, it no longer absorbs shock properly. That creates extra stress on the joint, and with the extra stress on the joint, it begins to dry out that much faster. And we have just described degeneration. As it gets dry, it creates stress, and as stress on the joint accumulates, it gets drier faster, and that is exactly what we mean by the word degenerative. It picks up speed as it goes downhill. So you could think of a disc, this rubber shock absorber, is a little bit like the shock absorbers on your car. The worse the shock absorber gets, the more the bumps in the road pound on the shock absorber, making the shock absorber that much worse and that much more unable to absorb the shocks. And until you have bad shocks on your car or a bad disc in your back, you just don't quite understand how bumpy the road can be. So that's one in drying out. Now, number two, because the disc is drying out, and sometimes simply because the disc is drying out, the outside walls are getting weaker and drier, and it begins to bulge. Now, a disc in many ways is like an automobile tire. The outside edge is thick and rubbery. It's a fibrous type material. The inside is filled with a shock-absorbing gooey substance. That shock-absorbing gooey substance is the stuff that dries out. And as it dries out on the inside, the outer walls are also getting drier, and it just literally begins to bulge. Now, because it bulges, and I'm going to hold up right here, another vertebrae, here's the bulge right over here. As you can see, this disc is quite a bit thinner than the original disc that I showed you. And because the walls of this dry, thin disc are weaker, it begins to bulge. So number one, it's closer together. That makes the nerve hole smaller. This particular model, I've left the spinal cord back here where you can see it. And here is one of the nerve roots that exits. And as that bulge gets bigger, it literally crushes the nerve backwards against the corner of the bone. Now, that explains a lot of things to you. If you've wondered why sometimes it's bad and sometimes it's not as bad, is that a good way to put that? That is because that bulge tends to come and go and come and go, somewhat dependent upon what you did or didn't do yesterday, and sometimes it just comes and goes and comes and goes, and there is really no rhyme or reason for it. That bulge pinches the nerve. Pinched is a verb. If it's being pinched, then something is actually pinching it. And in most instances, by far the hugest majority of the time, that is because a disc is bulging, it's herniated, it's protruding. Again, they have a lot of fancy names to describe it, but whatever you call it, it's still bulged and it puts pressure on the nerve. Now, what's the third sign that a disc is degenerating? Arthritic changes. As the disc gets drier, it absorbs less shock. That shock or stress to the joint can reach the point where just walking or ordinary standing, neither of which are an Olympic event, is enough to cause enough stress to cause enough pain to that joint. Now, you might guess that if bones are rubbing wrong or catching or whatever you usually like to call it when they're doing that, that if it rubs bad enough, hard enough, long enough, eventually it's going to wear down. And that is a logical assumption. But in fact, the exact opposite occurs. Bone is living tissue. And like other living tissue, like skin on your hand, for instance, if you're out in the yard with a shovel or a rake and you put a lot of stress against the skin, does it wear down or does it build up? It builds up, doesn't it? And they call that a callus. Bone also builds up under stress. And initially, they call those calcium deposits that are starting to form. And they have lots of fancy names for this too, as the calcium deposits build up. And what name they use depends on where it is and how bad it is and a lot of other factors. But whatever you want to call that, it's still arthritis. So there are three signs that a disc is degenerating. It's getting dry. Because it's getting dry, the walls on the outside are weaker and it wants to bulge. All of this combines and conspires to create stress on the joint that results in arthritic changes as it begins to build up. This is a third model that shows arthritic changes. You can see right on the front what looks like little icicles that are beginning to form. A normal vertebrae will have what are called smooth margins or smooth edges in a fat, happy disc. This model, the disc is almost non-existent. In fact, I have to pull it apart a little bit for you to actually see the disc. And these little things that look like icicles that are beginning to form are the end result of calcium deposits as they build up further and further and further. So what are the symptoms? We now know the signs of a degenerating disc. What are the symptoms of a degenerating disc? Well, number one, you'll have pain at the disc. The most common disc to become involved are the discs of the lower back, which makes perfect sense because the further down the spine you go, the more weight and pressure sits on each vertebrae, and naturally the ones at the bottom have the biggest job to do and are the most easily injured. The second most common place to have a disc degenerate is right where your skinny little neck fastens into your broad shoulders. And at that particular spot is also a weakness or a structural weak spot that is also more easily injured. The second symptom of a degenerating disc depends upon where the nerve goes. If the nerve's not pinched, you might only have pain at the disc itself. But if a nerve is involved, now we also have symptoms along the course of that nerve. If this nerve happens to come from your lower back and branch past your butt into your hip and down into your leg, then you're going to have symptoms along the nerve in your leg. And it may be pain, it may be numbness, it may be tingling, it may be weakness in that nerve going to your leg. The second most common place is, as I mentioned, at the base of the neck, where your skinny little neck fastens into your broad shoulders. That's a weak spot just from a structural standpoint. The nerves in that particular area go across your shoulder, into your arm, and down into your fingers. So you may have arm pain, shoulder pain. You may have numbness, tingles, weakness in your hands and arms. So there are two primary symptoms that a disc is degenerating: pain at the disc and pain along the course of the involved nerve root. Is degenerative disc disease a condition you should try to learn to live with? Well, let me ask you this. Is chest pain a condition you should try to learn to live with? Well, when you put it that way, it sounds ridiculous, isn't it? If you're experiencing chest pain, doesn't that make you think that there might be something wrong with your heart? I'm pretty sure you can live with chest pain. However, the underlying problem, the heart condition, comes back to get you. Should you try to live with neck or back pain as a result of degenerating disc? No, because that comes back to get you. According to the CDC, the Center for Disease Control in Atlanta, the number 2 reason for disability in America is spine and back problems. The number 1 reason for disability in America is arthritis. If you have arthritis in your back or spine, that kind of doubles up the reasons for disability in America, doesn't it? So I do not recommend that you try to learn to live with degenerative disc disease. There is an answer. The best answer is non-surgical spinal decompression. If you would like more information about this, send an email to the address listed at the bottom of your screen. In the subject line, put ebook 101 Things I Need to Know About My Bad Back, and I'll be happy to send you a free copy of this ebook and help you in any way that I possibly can. Thanks for listening.